you having trouble remembering things? Well, there may be a simple explanation. Joining me now is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine, talking about something called Pregnenolone, right?
Right.
Now, what is that? I haven't heard of this.
Pregnenolone is what we call the mother hormone. It's the hormone from which all the others are made. It's also called the memory hormone. If you're low in pregnenolone, your memory starts slipping. So kind of think memory loss. Everybody, that just starts happening, what, age 35,
Right.
40?
Well,
it's like
in some cases
all these
earlier,
lists,
yeah.
you can't remember where you put your list. You
Yeah.
can't remember names.
Yeah.
You just get confused about the details of the stories you want to tell again. And that's just a natural progression, a decline of our hormones, and the key one is pregnenolone. That hormone is the most concentrated hormone in the brain. It's made in the brain and in the adrenal glands, and from it we make progesterone and DHEA, then testosterone. It's a whole cascade.
So it makes sense that as we get older, a lot of us just write it off to we're just getting older, we can't remember, but truthfully you are losing something there.
We get old because our hormones are declining, and it's not just one hormone, it's all this balance of hormones that we need to look at. So it's a typical thing I see in all my patients. They never even heard of this hormone before.
Right.
But we need to look at that. So I'll tell you a story about a recent patient came in, Dina. She had a lot of symptoms of menopause. At age 51, she's coming in to see me, and she's got the typical hot flashes, night sweats. There's a screen will show you all the different symptoms. The low sex drive that she didn't really even think was so low at the time, but after she got that fixed, then she realized how low it was. Moodiness, irritability, fatigue, weight gain. And the thing that bothered her most was the memory loss, because her mother has Alzheimer's.
Oh, so she was
started,
worried.
it started age 50. They started noticing she kept asking more questions, forgetting things, needing more lists, more confused. By age 70, it was diagnosed as Alzheimer's. We really think this is a progression. So it's something that really needs to be treated. These are not just mere nuisances, these symptoms of menopause. The hot flashes are low estrogen, low testosterone. The weight gain can be low testosterone, low DHEA. The irritability, the moodiness, that's low progesterone. Those are also related to heart disease, cancer. We need to get those balanced and prevent all those things.
Is this one tested like the other ones, just through like a blood test?
Right.
Or
So in my patient, Dina, we got a picture of some of the lab tests that we did on her. Well, let's first look at a slide of all the different hormones. So this is what your body does. It makes them from cholesterol. This is why cholesterol is so important. So if women or men are on a cholesterol-lowering drug, they may be low in all these hormones. You don't want to push it too low, but you see pregnenolone is the very first one that's made, then progesterone, and it goes over to the right and makes DHEA, eventually testosterone, all the way down to estriol, that safe estrogen that you need to have. That's the most cancer protective thing you can do for yourself. Make sure you have enough estriol. So in Dina's case, we looked at all her symptoms in her lab tests, and she was low in almost every single hormone. The very bottom one you see is pregnenolone. She only had 35 units. We gave her the pregnenolone hormone supplement. Within 3 months, she was up to the optimal range of 125. And her memory was better. She's more alert. She's just saying, I can't believe how good I can remember things now.
Well, we always talk about the three, the estrogen, the testosterone, and the progesterone. So is this a fourth one that you need as well?
Yeah,
or?
There's about 10 that are key hormones that I test.
I see.
But those are some of the most prominent ones, and I want to educate more people about all the different hormones. It makes such a difference.
Sure.
She feels so great. She's alert. She's confident now. She can remember. She's not worried about losing her mind, becoming like her mom.
Yeah.
It just makes a world of difference. You can throw away all those lists. Don't have to check them twice.
Yeah, I'm sure she feels more relieved too. Yeah. Now you have a special promotion for people who are watching. I know a lot of people want to get tested.
Go to our website. On the website, you'll see our new newsletter. Sign up for the newsletter. You're automatically entered into a drawing to win a free hormone test. So one person's going to win a free hormone test who signs up today for that
and then they'll
newsletter.
know exactly where you're at and what's low, what needs to be treated.
See the story about Dina and learn about all the hormones.
Really important. Thank you, Dr. Hansen.
Right,
good to see you too. So once again, if you would like more information about the Hansen Clinic of Natural Medicine, please go to Dr. Hansen's website. It's drhansen.com, or you can call the number you see right there on your screen.